Okay, Assalamualaikum warahmatullahi wabarakatuh, and a very good day to all. So today we're going to hear lecture 8, which is our second last lecture for this whole semester, which is will be going on health improvement program. So our focus for today's lecture is on nutrition and HIV/AIDS. So the purpose of health improvement program for nutrition and HIV/AIDS is okay, the purpose of kita buat program untuk nutrition AIDS ni adalah supaya kita dapat mitigate the effects of HIV on nutrition, which means to reduce the effects of HIV on nutrition and to reduce the progression of HIV or AIDS morbidity, mortality and related discomfort. So tujuan kita ada satu health improvement for the HIV is to what? To reduce the effect of HIV on nutrition and also to reduce the progression of HIV itself towards the morbidity, kematian, kesengsaraan, mortality, kematian dan related discomfort. Okay. Okay, so the goals of nutrition care and support for those having HIV or AIDS is first, we want to improve the nutrition status, okay, by maintaining weight and prevent weight loss and preserve muscle mass. Okay. Number 2 is to ensure adequate nutrient intake. So we need to improve their eating habits and diet and replenish stores of essential nutrients. Number 3, we want to prevent foodborne illness because if they have foodborne illness, it will worsen their HIV or AIDS sickness, alright, because they have low immunity. And number 4, to enhance quality of life, which is to treat opportunistic infection and manage symptoms affecting food intake. And number 5, to provide palliative care. So palliative care is to give comfort to them, right? So we're going to have 3 components of nutritional care and support. First is we're going to have a nutritional assessment, and then after we assess them, we're going to have an intervention for them. And after we have conducted an intervention, we're going to do a follow-up review. So the first component is nutritional assessment. So why do we measure them? Because we want to identify and track body composition changes in either changes in body cell mass, fat mass, and also perhaps serum levels or something, and then also cholesterol over the times and trend. We want to look at the trends and to use result to design appropriate intervention and to address client concern about their health. So once we have all these data on their body composition, we can design an appropriate intervention for them. So what do we do? What do we measure? Measure as usual the ABCD assessment, which is anthropometry, biochemical assessment, clinical assessment, and also diet history assessment. Right? So this is, we can look at the main symptoms of acute HIV infection. So when we do anthropometric measurement, what do we do is first we assess and monitor weight. Okay. Number 2, assess and monitor body composition as well. Look at the skin fold, tricep, bicep, necktie, circumference, and also their body mass. So their BMI classification is not really the same as the WHO, the one that we use for our normal BMI classification. So for them, they have a different BMI classification. You have to remember this. So for less than 16, it's classified as severely malnourished. 16 to 16.99, moderately malnourished. 17 to 18.49, mildly malnourished. 18.5 to 24.9, normal. And 25 to 29.9, overweight. And more than 30 is obese. So for the underweight, they have put details into it, right? Because normally those who are infected by HIV AIDS, they tend to have low body weight and also have very high level of body mass kehilangan body mass yang banyak lah. So for your biochemical measurements is first to assess and monitor nutrient level and looking at their hemoglobin, serum micronutrients. And second is to assess and monitor body composition as well, which is look at their fasting blood sugar, lipid profile, and serum insulin. And for the clinical assessment, what do we assess for the clinical assessment? We look at their whether they have diarrhea, whether they have fever, whether they have mouth and throat sores, or whether they have oral thrush. So this is what oral thrush means. And muscle wasting, fatigue, skin rashes, edema, and pallor. Alright. So for diet history, we use the 24-hour food consumption or food frequency records to look at the types and amounts of food eaten, use of supplements and medication, and look at factors affecting their food intake. It's either they have reduced appetite, different eating patterns, medication side effects, lifestyles, taboos, hygiene, psychological factors, stigma, economic factors, right? So component number 2, which is intervention, because after we have done the assessment, nutrition assessment, we will do a suitable intervention for them. So we have to identify first at which stage our client are having their disease, right? So for those at early stage, no symptoms seems to be appeared. They still have stable weight. For middle stage, they have weight loss, opportunistic infection associated effects. And late stage, they have the symptomatic AIDS, which is the symptoms of AIDS appeared. Okay, so we have to identify first at which stage does this client is having their HIV disease progression. So for nutrition counseling, we focus on increased food intake, eat a variety of food, and manage symptoms and drug-food interactions. So these are the main things. You have to ask them to increase their food intake because they tend to lose weight very fast when affected by HIV AIDS. Eat a variety of foods to give a varieties of nutrients, right? And manage symptoms and drug-food interaction. So they have 4 interactions between ART and food and nutrition. So ART is referred to the antiretroviral therapy, which is to prevent or to stop the HIV from progressing, right? So food can affect ARV efficacy. So some foods can affect the ARV drugs, and some ARV can affect the nutrient utilization, and ARV side effect can affect food consumption or nutrient utilization, and combination of ARV and certain foods can create unhealthy side effects, right? So banyaklah kesan dia, okay, of the ARV towards the food consumption or some of the foods towards the ARV efficacy. So based on the stage of the HIV progression, so whether you have, the client have asymptomatic or middle stage or late stage, so their care and support differ by each stage. So for those who have asymptomatic, we encourage building stores of essential nutrients and maintaining weight and lean body mass, ensure understanding of food and water safety, and to encourage physical activity. So for those who have middle stage, which is we have to counsel them to minimize the consequences of the HIV effect. So we counsel them to maintain dietary intake during acute illness, advise increased nutrient intake to recover and must gain weight, and encourage to continue physical activity. Yes, it's easy to be said rather than to be done. Once those who are affected by HIV, they won't bother, they won't care. They just, they're too sick to do activity, right? even us who is already healthy pun kita dah malas nak buat physical activity, apatah lagi mereka yang dah sakit, right? So for those late stage is bila dah berada daripada kadar stage yang dah lewat sangat, we just provide comfort to them, which is the palliative care. So we advise on treating opportunistic infection, counsel to modify diet according to symptoms, encourage eating and physical activity. So bila mereka dah tahap yang terakhir ni, dah tak lalu dah nak buat apa-apa pun, so we just keep on giving them diet that would suit them. Okay. So these are the nutrition action for HIV infected people. Right. So we need to promote adequate nutrient intake. Okay. So identify locally available and acceptable foods for those HIV patients and promote a diet adequate in energy, protein and other essential nutrients. So normally we do promote to increase energy intake by 10% to 15%. So for example, it's an adult, a male adult in the age of 21, for example, the requirement, for example, for that client is 2000 calories, for example, their normal calorie intake. But once affected by HIV, we need to increase them by 10 to 15% more from the normal calorie intake, as well as their protein intake, as well as the variety of the foods, alright? And we also need to promote multiple micronutrient supplements to improve their immune function, alright? So we need to consider also stage of illness and symptoms, food security, and because when we said food security, because those who are having HIV or AIDS, sometimes they are being left out by their family, so the availability and accessibility of basic foods is also a question. And then do they have resources like money, okay, and food like and dislikes. Also their knowledge, attitude and practices would be, lesser than the healthy person. Okay, so these are the things that you need to eliminate from the client if they have HIV, raw eggs and unpasteurized dairy products, okay, because we want to avoid from having foodborne illness, right? Foods not thoroughly cooked, especially meats, unboiled water or juices made from unboiled water. And try to avoid foods that may affect food intake, for example, alcohol and coffee, junk foods which have so little nutritional value, and foods that aggravate symptoms related to diarrhea, nausea and vomiting, because we don't want them to have less water or to reduce all the symptoms related to nausea and vomiting, right? So we also recommend regular exercise. Again, it's not easy to be done, but those are things that can improve their lean body mass, body composition, bone density, and quality of life, and also appetite. So these are the exercises that build muscle mass. Okay, you can have a read on it. Okay, increase vitamin and mineral intake. Okay, so because they normally don't have appetite to eat fruits or vegetables, but we need also to recommend them to have accessibility towards vegetables, vitamin enriched or fortified local products. Okay. And we do recommend to optimize immune function by having or by taking nutrition supplements. Okay. So these are the suggested nutrient supplement. Vitamin E from 2 to 4 RDA, recommended dietary allowance. Vitamin E 4 to 800. Vitamin C 1005 to 2000 milligram. Selenium 200 microgram. Zinc 1 recommended dietary allowance. Right? So these are the adverse effects of taking too much intake of nutrient supplements.